one of the things that I know that vitamin C plays a decisive role is in toxicity, and then a specific toxicity from vaccines, and then I'm talking about shaken baby syndrome, because what I have heard from Vera Scheibner, for instance, but also other researchers, is that when a baby gets injected with a vaccine, this is a avalanche of toxicities coming into the body. And if the body hasn't enough free vitamin C to counteract the toxicity of what is coming in, then the body will get the vitamin C out of the own tissues. And that is when bones get broken and veins will bleed and hemorrhage, because vitamin C is a part of the stuff that our bones and our veins are made from.
No, that's absolutely correct. What I think is important for your listeners to understand is that all toxins, and this is an interesting concept, and I think it's completely valid, all toxins, regardless of their chemical structure, ultimately cause damage to cells or tissue by depleting or taking away electrons. And because this is the final common denominator of toxicity, if you will, is the reason why vitamin C can non-specifically neutralize the toxicity of any toxin you can put in front of it. And this is what gets borne out as much as anything else in my book, Curing the Incurable. I mean, we looked at well over 100 different toxins, and all of these toxins, one way or another, were either neutralized by vitamin C, or the toxic effect that they had in the tissues was reversed by vitamin C, which, of course, being an antioxidant, is an electron donator. And really, toxins are really nothing more than that, which is taking electrons away rather than having electrons donated. And to more specifically address your point that you're talking about the vaccines, is when a large enough amount of vaccination is done and the nutrition status of the infant or vaccinee, if you will, is poor, the toxins will deplete the vitamin C and other antioxidant stores in the tissue, and then when you have a disruption or shaking of the baby, if you will, the collagen and the connective tissue status inside the body will be very poor, so that an amount of agitation that would normally have no significant effect on the infant can cause tearing and bleeding, and the whole result that's known as shaken baby syndrome. So while I'm not going to say that there haven't been some parents out there that have damaged their children by shaking them too hard, much of the time, I can't tell you what percentage, but much of the time, you have horribly persecuted and innocent parents getting dragged into a court of law simply because their baby didn't have enough vitamin C, had too many vaccinations and other toxins, and when agitated with just little or no shaking, actually, it can take place in the absence of shaking. It's basically a form of induced scurvy. Yeah. And this is what happens in scurvy, is the connective tissue becomes so delicate, so friable, that what would be normally a readily tolerated amount of physical agitation can cause catastrophic bleeding. And in a nutshell, that's your shaken baby syndrome for a lot of horribly persecuted parents, because obviously they love their babies, and next thing you know, they're being charged in a court of law that they were viciously shaking their infant until all of this brain damage occurred, which, as I said, can certainly occur on occasion, but I think a horribly large number of those patients, of those babies, are vitamin C deficient, resulting in that particular syndrome.
Yes. There is doctors, pediatricians in the hospitals have this knee-jerk reaction when they see a child with retinal bleeding and broken bones, that the parents did something wrong, while in effect it is the vaccination that did something wrong to the baby. But there is one little test that people can do, and I stress this every time I have the chance, is when the pediatrician is accusing the parents should demand a test of the vitamin C levels and the histamine levels in the blood and in the serum, because that is conclusive to see whether it is child abuse or vaccination damage. And
that's an excellent idea and suggestion, Désirée. I think that's a very, very good way that would probably differentiate the vast majority of these cases. I think that's excellent, and I'm sure you might have trouble because pediatricians are doctors who don't like to be told or suggested anything. But if you do have a pediatrician that's at least a little bit open-minded, that's a very good thing and a very good suggestion.
Yes, and maybe this is a point in time when a parent needs a lawyer to demand that the pediatrician does the test. I mean, it is a difference between life and death for the parent. I mean, or jail or no jail, and losing your kid, because I have witnessed a couple of cases in this respect where the parents have lost their baby, or how you say that in English, they weren't supposed to be the parent anymore. I mean, their guardianship was taken away from them, and it was horror, and they were never there when their baby eventually died in the hands of these doctors.
You know, I hope that what you're saying is starting to evolve, and that is, even though I'm a lawyer, getting lawyers involved in things, in my opinion, is generally something you want to avoid along most of the things that we encounter in daily life. But in a situation where people are not given any other reasonable alternative, which is cases that we're talking about of medical care, where you're getting absolutely stonewalled by your doctor, and you have every reasonable scientific reason to believe, for the reasons that we're talking about, that a vital treatment is being withheld from your baby, child, or relative, I think it's high time that we undergo a major evolution, if you will, in how we approach our medical care, and be ready on a moment's notice to bring in the services of a lawyer to let the doctors and hospital know the liability they're facing if harm comes to your relative before they receive some of these simple, non-toxic therapies.
Yeah. In the break, I was saying I was so glad that you reassured me that it basically doesn't really matter where the sodium ascorbate is coming from as long as it's purified, because that makes it so much more easy to get it in enough quantity to get through life healthily.
And maybe we should reiterate the point, Désirée, that while a whole, intact, genetically modified food might be bad or toxic for a number of different reasons, even if a chemical or a nutrient or a purified substance comes from a GMO origin, if there's an adequate amount of purification, it doesn't really matter. And it should be approached in a scientific fashion and not a hysterical fashion, like if something just touched GMO, it has to be bad. So I'm not in any way supporting GMO. I'm just saying that if you get something from a GMO product and it's very well and properly purified, in this case ascorbate, it's not anything you need to worry about in terms of any undue toxicity.
No, okay. There is a question that comes to my mind. I had a mother calling me about the fact that she wants to breastfeed her baby, and she has done so for 3 months, but she has this recurring breast inflammation. One of her breasts is, and she gets very sick with fever and all that. And then I suggested to her to take vitamin C in larger amounts. And she was worried about how that would affect her baby. And I said, well, I don't see any wrongdoing towards the baby when it gets more vitamin C into its tissues. What's your take on that?
No, you're absolutely correct. Well, so many pregnant women and young mothers hear so much about don't do this during your pregnancy, don't take this, or don't expose the young baby to this. And while I'm not saying all of that advice is bad, it makes them unnecessarily susceptible or hyperreactive to what should be a pretty much common sense type of thing, as you addressed. Certainly, whatever the baby is ingesting from an inflamed and possibly infected breast is going to be better for the child and less toxic to the child if larger amounts of vitamin C are coming in. Yeah. So not only is that logical, it's also supported by the fact that Dr. Klenner, who had pioneered the use of the megagram vitamin C in different conditions, also practiced a general family type of practice, and he had and delivered a large number of babies over the course of his time in private practice, and he would routinely get all of his pregnant mothers on somewhere roughly around 10 grams of vitamin C a day throughout their pregnancies. And the nurses at the hospitals that Dr. Klenner had as privileges would always refer to the Klenner babies. And they referred to the Klenner babies because the Klenner babies were always the most obviously healthy. The mothers had the least problems with their pregnancy, the least complications of their delivery. And it was a good, while not a controlled scientific study, it was a good indication of the benefits of vitamin C before, during, and after pregnancy.